It's Hump Day with Dr. Alex Earl, and we're here at Pure Plastic Surgery, and it is the first Hump Day of 2026. That's right, we're kicking it off here today. I know it's already kind of like mid-January, but I've been out for a few weeks and actually then had to do a procedure on myself, but no worries, we're back in action. And so yes, I am so happy to be starting Hump Day for 2026. I've been doing this for multiple years now, I think like 7 or 8 years now, and it's been really, really cool. And you know, we've always had a solid amount of followers on Instagram, but now our TikTok followers are starting to grow every time more and more. So remember, this is a time that I get to spend with you guys. I get to go over some plastic surgery topics, and then of course answer any plastic surgery question that you may have. And we can talk about anything that you wish. We can talk about complications, we can talk about pre-op, the surgery itself, the procedure, post-op care, etc. I'm happy to go over everything from head to toe. And you know it's coming from a good source, reliable information, because I am a double board certified plastic surgeon, and I am Ivy League educated, Duke trained, and I've been in practice for over 12 years now with thousands of cases under my belt, okay? All right, so what are we going to do today? Today we're going to talk briefly about a procedure that is going to be like probably one of the ones you're going to be hearing about the most this year, 2026. I think it is going to be the year for this procedure, the rib remodel procedure, right? It's something that kind of started last year. A few people got in early, like myself. Last year I did a lot of the trainings. I did some trainings here in Miami, did some trainings in Colombia with some of the best in the world, and then I brought this back here to Pure Plastic Surgery. I've been doing these cases for a few months now, and I'm super excited about it. And this is what's called the rib remodel procedure, all right? Now, it doesn't go by other names, so you guys may have heard other similar names to this, and it's a very important to know because it's all really the same thing, right? So it's the rib remodel procedure. That's what I like to call it here, but it's also been called rib X-Scar. That's by Dr. Manzanella's group. So they kind of took that name for their procedure. Some people call it rib sculpt. We've also heard the names B-waist or Barbie waist, and that's where like Dr. Oya's group, which is where I trained. And then you may also have heard the term wasp waist, okay? So these are all similar terms for the exact same thing. It's all about the rib remodeling procedure. So it can be confusing because the rib remodel procedure has different names, but also people are associating it with what used to happen in the past, which was actual rib removal, when you were actually taking ribs out, okay? And so what I want you guys, the first thing I want you guys to understand is that this is not rib removal. It is not rib removal, okay? We are not removing ribs, because that's the first thing that pops up. People are like, oh my God, isn't that extreme? Isn't it dangerous? Isn't it gonna hurt a lot? And they're thinking rib removal, right? So yeah, you're removing ribs and you're removing some of the natural protection that your body has for its internal organs. It's definitely a lot more invasive procedure. It involves big incisions. There's higher risk of bleeding or pneumothorax or any sort of these issues. And of course, it's going to be a lot more painful because you're actually taking the ribs out of the body. Okay? So this is not that. Okay? Everybody understand? First things first, right? We are not removing ribs. We are simply reshaping the ribs. Okay? Not only that, but we're focusing on what we call the floating ribs, which are the safe ribs. So we're just focusing on the safe ribs. Okay? So only on the safe ribs, which are ribs 10, 11, and 12. That's it. Okay? That's the other thing, because the higher you go, the riskier it gets. But these ribs are safe because they are floating ribs, which means that they don't have an attachment here in the front, and they don't have what's called a neurovascular bundle. It means that they don't have an artery, vein, or nerve attached to it. So that makes it safe because there's a much less chance of any like major bleeding, okay? And also, it makes it so that it's virtually not any additional pain to whatever procedure you're already getting done, because there's no nerve associated with these ribs, okay? So it makes it very low pain and very, very safe when you focus specifically on these ribs, okay? And guess what? There is actually no incision. There is no cut. Believe it or not, the reason why I started doing this and why we're doing it today, because number one, it can be done very, very safely now, okay, because of new techniques and new technology. But also these new techniques and technologies allow me to do it in a way where there is no cut, there is no incision. It is all done through an 18 gauge needle hole. So it's a virtually scarless technique, okay, which is amazing. It's amazing how we can actually remodel your waist. We can bring your waist in, really shrink in that waist in a way that we've never been able to do before through an 18 gauge needle hole, a virtually scarless technique, okay? So that's really interesting for all of you to understand. So you put a little needle hole over each rib. So there's 3 per side. So there'll be 3 on the right side for 10, 11, and 12. And 3 on the left side for 10, 11, and 12. Each one a little tiny needle hole that will basically heal and you can't see it. It won't be seen. A virtually scarless technique, okay? And so what we're doing through this needle hole is that we're using a machine called a piezotome, and you don't need to know all the technical details, but this is an advanced machine which allows us to create a controlled fracture of that rib. And so what does a controlled fracture mean? Well, imagine this is your rib. And so the rib has an outer cortex, the one that's more superficial, and an inner cortex, okay? And so what we're doing is that we're making an incision only on the outer cortex of the rib, such that in a way that we can then bend the rib or sculpt the rib or reshape the rib and create a narrower angle. But it's not a full fracture. You're not doing this. You're just creating that fracture in the outer cortex, very controlled, so that you can then bend or re-angle the rib, and then you can have a smaller waist. Imagine if you have your ribs that are kind of flared out like that, which are causing you to have a big waist. Now we are able to bend them in, and that's going to make the circumference smaller, which is going to bring your waist in, which is going to make you have a smaller waist, and that's the way that it works. And it's done in a very controlled way, so that we're able to reshape those ribs. And again, we're only doing those safe ribs that don't have a neurovascular bundle, so there's no artery, vein, and nerve associated with it. So it's very, very safe, okay? So that's basically how it works. And I put up some videos. If you guys want to see how I actually do this, there are some videos that we put up on Instagram and TikTok, so please go check those out, okay? So who is this for? Well, like everything, it's not for everybody. Right? I have to be able to reach the ribs, and I have to be able to touch and palpate, what we call palpate, or touch the ribs. So you cannot be someone that has a lot of fat over those ribs. Okay, I have to be able to reach them. So it's typically for our lower BMI patients that are a BMI of 25 or less. Okay, which anyways makes sense, because if your BMI is between 25 and 30, we can achieve a very huge difference with just liposculpture alone. And we don't necessarily have to do the rib sculpting to really create that hourglass shape, okay? But as we get lower and lower in the BMI scale, there's less fat that we can remove via liposculpture. And so if we remove whatever we can with the lipo, but you still have a little bit of too much of a flared waist because the ribs are not letting it come in, well then that's when we can add the rib remodel. We can create that green stick fracture. We can then reshape the ribs and really bring that waist in. So it works really well for our athletic patients, right? You're kind of your lower BMI, anywhere below 25. You're kind of that athletic patient, but you always wanted to have a little bit of a curve, and it doesn't have to be crazy, but just a little bit of a curve, because and you've always felt like you work out like hell, you eat super well, and you look like this, right? Athletic patients, you know what I'm talking about. You look straight up and down, right? No curve. So if you want to be athletic and have a little bit of a curve, this is the perfect procedure for you, okay? Because we can then remodel the ribs, we can shrink in that waist, we can add a little bit, whatever little bit of fat that you have to your hips, and now you go from being straight up and down to having a little nice, beautiful, enhanced, natural, curvy shape. And that's what we're looking for here, all right? Now, because we are dealing with bone, okay, and in women, especially after menopause, the bones can become brittle. There is an age limit to this. So typically, we're going to do it in women that are 40 years old or younger. So typically not older than 40 years old. If you're between, say, 40 and 45, we can consider it, but we may have to do some additional testing to see how your bone structure is doing and that you don't have something called osteoporosis, okay? So if you're between like 40 and 45, we may just ask you to do that additional testing, make sure there's no significant osteoporosis, so then we can move forward with the procedure, okay? So like I said, perfect for athletic patient. And then of course the next question is going to be, what can I combine this with? Well, you can combine it with just about anything, okay? But the most common thing that we combine it with is your liposculpture BBL. So liposculpture 360 and BBL, which also includes liposculpture 360. So I like to think of this as like taking that BBL now to the next level. This is BBL 2.0, where we're combining liposculpture. We can even combine some high definition, and then of course the fat transfer to the buttock and hips, and the rib remodel for a beautiful, beautiful change. We are going for those beautiful, enhanced, natural looks, and this is what allows us to do that, even if you have a lower BMI, even if you don't have that much fat in your body. So it can be combined with BBL, can be combined with Lipo 360, can be combined with a tummy tuck, can be combined with any sort of breast surgery as well, okay? So we can certainly combine this procedure with many of the other procedures that we do, okay? So that's kind of just very briefly as much information as I can give you about that, but I am happy to answer any questions regarding this procedure or anything else in plastic surgery.
Okay, first question about this is, after surgery, will we have to wear a faja?
Oh, that's right. So great question. I should have put that on here too. What is the post-op care? Because that's a super important question, because there is a commitment to it, and I should have mentioned this from the get-go. If you're going to do this procedure, you have to commit to using a corset for 3 months, okay? If you're going to do this procedure, you're going to have to use a corset for 3 months, okay? And this, my friends, this is non-negotiable, okay? If you cannot commit to a corset for 3 months, don't do the procedure, because it's not going to work, okay? Because the ribs that we kind of remodeled and reshaped, they got to stay in that shape for a while until they kind of heal into that new shape. And if you're not wearing that corset, they're going to want to bounce back, okay? So in order for this to work, you have to wear that corset for 3 months.
If my thyroid is slightly elevated, can I still get a BBL?
Yeah, certainly. So typically, being hyperthyroid or hypothyroid is not a contraindication to a BBL or any other elective procedure in an office-based setting. What needs to happen though is that of course it needs to be controlled, so you have to be on your medications. And we are going to check some labs. We're going to do like an endocrine panel and check all your thyroid studies and make sure that that's okay. And then the last part is that we're going to get a medical clearance from your primary care doctor, and so they have to be able to clear you as well. But if you're able to check those boxes, then yes, you can certainly have your BBL.
I've scheduled my extended tummy tuck with you.
All right, awesome.
Is there a chance I may not be a good candidate for Smart Tuck? And what's the BMI range difference compared to tummy tuck versus Smart Tuck?
Great question. So Smart, first of all, for those that may not know, so what is the Smart Tuck? This is our latest innovation that we had towards the end of last year, and it's basically my signature tummy tuck. It's taking the tummy tuck again to the next level. In the same way that we're taking the BBL to the next level, to the 2.0, we're taking the tummy tuck to the next level, to the 2.0. And so what does it include? Well, it includes everything that you would with your regular tummy tucks. Of course, the skin removal, the muscle repair, the liposuction along the flanks and the waist. But then you're going to add some soft etching, some sort of HD to that. Okay, so you're going to have a soft etching, and then we're going to add some additional lipo to the axillary, so beneath the armpit area, axillary regions, the subaxillary region, and up here as well for more further reshaping. And we're going to also be adding some fat transfer to the hips. So that's what really makes it really kind of stand out, because now instead of kind of those kind of old school regular tummy tucks where people may end up still a little bit straight up and down, now we're really bringing out those curves. We're doing additional lipo, we're doing some of that HD, so we go for that and kind of smooth, natural, enhanced athletic look. And we're adding a little bit to the hips, so now you're going to have like a curvy, enhanced athletic look, which it's really, really awesome. And so we can do that with an extended tummy tuck, right? So it really depends on your evaluation. Because we are doing some of that HD, right? Of course, it can be like a higher BMI patient in terms of like close to 30 or above, certainly not above 30. But yeah, if your BMI is somewhere around 25, certainly below that, you're probably very likely a candidate for the Smart Tuck. And so I think what I would do is that if you're already set up for your extended, I would just kind of reach out to your coordinator here at Pure, ask her the questions so that then she can ask me, and I'll review everything and get back to you.
Thank you. So speaking in terms of rib remodel,
yes.
Can you do it by itself? Do you have to be under anesthesia to get this done?
So the question is yes to both questions. Can you do it by yourself? Yes, you can certainly do a standalone rib remodel procedure. For that, you certainly have to have your BMI 25 or below. Remember, I have to be able to feel the ribs and reach the ribs with that special tool, that piezotome that we talked about. But yes, it can be a standalone procedure, but it does require general anesthesia. Okay, so it has to be done under general anesthesia. Reason for that is that there has to be zero chance that you're going to be moving. Okay, we cannot have you moving at all during that procedure. Of course, everything is very controlled, and if you can do things controlled in that way, it's very, very safe. Okay, but we cannot risk the patient moving around when we have that tool doing that controlled fracture of the ribs.
All right, TikTok question.
TikTok, here we go.
If I keloid, is there a scarless option for other surgeries like a BBL?
So it's not fully scarless, but a BBL has very, very tiny incisions, typically less than 5 millimeters, and they can be placed in areas that are very well hidden. And also, depending on who you go to, they can minimize the number of incisions needed. So what we do here, especially if you do like my signature South Beach butt lift or So BBL, I minimize the number of incisions. I make sure that they're in very well hidden locations, and they're very, very tiny, about 3 to maybe 4 millimeters max. Okay, so that's what can be done. And of course, we'll see on top of them, starting at 2 weeks post-op, you're going to start using silicone-based scar creams, and that's going to help. And if you need something else, further down the line, such as a catalog or steroid injection, or maybe some laser or IPL treatments, that's something that can be done as well.
Okay, so we got an Instagram question from Official Tsunami. This is interesting. She says, how come we can't get surgery from you anymore? You're not available on the website. Maybe
What? That's
something we should check on.
Yeah, that does not make sense. But yes, you can certainly get surgery from me. I am pretty much booked through March, so the first available dates might be a bit later, in late March or April. But yes, reach out to me via DM and we'll get back to you.
All right, so for TikTok question, if you already have mild fibrosis from liposuction, if you get another round, will you get more fibrosis?
So not necessarily, okay? Now fibrosis can be a little bit tricky. Some people are just naturally more prone to it, or it could have been that maybe you didn't have enough massages or the post-op care just wasn't adequate, all right? So we gotta find out a little bit of the reason why you have the mild fibrosis. But having said that, you can have another round, and we can work in a way that hopefully you actually have even less fibrosis than what you're starting off with, okay? In order to do that, for the most part, you have to add Vaser. So that's certainly what I recommend. I'm not sure, I do Vaser for all of my patients. If you're coming to me, the Vaser is already part of the deal. But if you're going somewhere else, I would make sure that they use something like Vaser to really help with that fibrosis and try to break up your current fibrosis and minimize more fibrosis after your second round.
Thank you. Do you perform lipedema surgery?
So I don't do lipedema surgery. So there are other surgeons, of course, plastic surgeons out there that do it. But no, sorry, I don't do that myself.
Side note, is a combination of Lipo 360 and tummy tuck possible?
Of Lipo 360 and tummy tuck. So here's the deal. Is it possible, just like in big general terms? Sure, it's possible. But here in Florida, we do have some special rules. And one of the rules here in Florida is that when you do a tummy tuck, you're limited as to how much fat you can remove, which is only 1,000 cc's. Now, this is a rule that is given to us by the Florida Board of Medicine, the Florida Department of Health, okay? And this is a rule, of course, that applies to all surgeons in Florida, right? So it just so happens not all surgeons follow the rules. But that's my question to you. Do you want to go to a surgeon that doesn't follow the rules? Like, does that make you think like what other rules are breaking? So no, I wouldn't recommend that. So here in Florida, because of this rule, I typically don't combine your Lipo 360 and your tummy tuck because usually 1,000 cc's is not enough fat really to be able to do a full 360 for most patients. Exceptions to the rule, well, what if you're truly a lower BMI patient, say your BMI is 20, 21, 22, then yes, in that case, we can do a Lipo 360 and a tummy tuck because you probably don't have a lot more than 1,000 liters of fat in your body, okay? But for everybody else, it's best to separate out the procedures so you have the best result. And I do recommend doing your tummy tuck first, okay, so we can deal with the skin and the muscle issues, and then you can come back, 3 months later or sometime after that and do your Lipo 360 plus minus fat transfer or BBL.
Thank you. What if I don't know what kind of BBL I want? Do you have recommendations based off body type?
Yeah, of course. And so in terms of BBL, you know, it's really going to be a lot, it's going to be tailored to you and your body and your underlying foundation. And so, you know, you're going to give us an idea of kind of what are the looks that you like, what you're going for, and then that's what we're going to try to tailor to you, okay? For the most part, I think, you know, kind of my signature style, and I think what looks really, really good, and it's a long-lasting result, an enhanced natural result that doesn't look like fake or surgical or anything like that, is to create some nice kind of curves in the front, what I like to call just like an Earl curve, an hourglass shape, and then that upside-down heart shape from the back.
All right, we got some interesting TikTok questions.
All right.
I have $100. What can that get me?
$100 might get you a consultation with Dr. Wigger, but I think that's about it. But hey, you know, if you're interested in other stuff, you know, remember, there's always plenty of options out there in terms of financing.
Next question is, can you talk about the far upper abdomen, please? Reverse tummy tuck.
So the reverse tummy tuck. Okay, so you know, as you all know, when you're doing a typical, your regular, or even mini tummy tuck, what you're doing is you're basically cutting excess skin from the bottom and pulling things down, okay? But what has become more popular actually recently, and I think a lot of this has to do with how much liposuction is going on, is that we do what's called a reverse tummy tuck. So instead of pulling things down, we're pulling things up, okay? So we're taking off some excess skin in the upper part of the abdomen, we're pulling things up and then putting that incision, and typically for women, we're putting that incision in what we call their inframammary fold, that natural crease just beneath the breast, okay? And so what happens a lot of times after a Lipo 360, sometimes the skin doesn't bounce back all the way because there's some skin laxity or some, you know, loose skin issues before. And so it looks nice and tight below the belly button, but it can be a little bit loose above the belly button. And so for those particular cases, the best solution is to do that reverse tummy tuck. So we're able to remove that excess skin on top, in the upper abdomen, okay? And then pull things up and then just kind of tuck it in beneath the breast in that inframammary fold. And it works especially well when we're combining it with a breast lift because we're using that same incision. So the lower part of the breast lift is the same incision that you're using for that reverse tummy tuck.
All right, what's your BMI for a BBL?
So my BMI, my max BMI is 30, okay? So and in terms of the range, typically if you're below a BMI of 20, you're too skinny, so it's gonna be between 20 and 30 for the most part.
How long do you recommend to be in a garment after a tummy tuck?
So this is my post-op kind of strategy after the tummy tuck. So initially you're gonna be in what's called an abdominal binder, so it's kind of this white thing that wraps around you to give you some support. You're gonna be in that abdominal binder until the drains come out. I do use drains, and you're gonna have 2 drains, okay? Once both drains come out, you can switch from the abdominal binder to a garment, to a faja type garment. And so that faja type garment, you're gonna use night and day, or 23 hours a day, up until you get to the 6-week mark. And then between 6 weeks and 12 weeks, you're gonna wear the faja 12 hours a day, okay? So abdominal binder followed by the faja or garment, 23 hours a day until 6 weeks. Between week 6 and week 12, you're gonna decrease it, you're gonna come down to 12 hours a day.
What's the reason to one breast feeling more hard than the other one?
Just in general, or after surgery? I mean, it's a pretty broad question. So breasts can certainly feel different just in general. There may be more, typically what the most common reason is that one has more cysts than the other, so it's more fibrocystic. You may have a little bit more fibrocystic breast on one side compared to the other. or it can also be like a hormonal issue. So when as you go cycle through your period, one breast may have more kind of breast tissue that's sensitive to the differences in estrogen, and that can cause that as well. In terms of surgery, and if it's early post-op, quite easily there can simply just be more inflammation on one side than the other. That's not uncommon. They typically don't have the same inflammation. They typically don't settle at the same rate as well. Things to look out for though, especially if we're talking post-op, is you want to make sure that there's no either fluid accumulation or blood accumulation on one side. So fluid accumulation is called a seroma, blood accumulation is called a hematoma. So that's something that you definitely want to check with your surgeon. Make sure that they don't feel like one of those things are going on, because either if you have fluid accumulation or blood accumulation, they typically need to be drained or evacuated.
I'm from Boston. Do you do video consultations?
Yeah, we certainly do. So we do virtual consultations and video consultations, and of course in-house consultations. But keep in mind, about 80% of our patients actually are not from Miami. They're coming from out of town. So different states, different countries. I just saw today 2 patients that came in from Canada. So we're doing 2 patients coming in from Canada tomorrow as well. So yes, we certainly are catered to people coming from out of town. You can do a virtual consultation right off the website, www.puroplasticsurgery.com. And you can hit a button that says virtual consultation, or start your journey. And so we can do that virtually, and that's at no cost, $0. Now, if you contact us and you want, on top of that, you want to do a video consultation with me, we can certainly arrange that as well. And I'll do the video consultation. That does have a cost of $250, but it does go towards your procedure if you book your procedure. So it wouldn't be additional to your procedure.
Thank you. Would it make more sense to just get a tummy tuck or go for the full mommy makeover?
I think if you're gonna do it, you might as well just go for the mommy makeover, right? So that's really, so what is a mommy makeover? Well, typically it involves the tummy tuck that you mentioned, but a breast surgery. So if you have any sort of concern with the breast, you want a lift, you want an augmentation, it can be combined with any breast procedure, right? So I would definitely just do it all at once. It's very common to combine those 2 things. It doesn't really add, that much more time in terms of being under for general anesthesia. So yeah, go for the mommy makeover.
How many liters of fat can you take during Lipo 360?
So here in Florida, that's going to vary again from state to state, country to country. But here in Florida, the max that we can remove from liposuction, liposculpture, BBL is going to be 4 liters or 4,000 cc's.
Can you get breast implants, Lipo 360, and a BBL all at the same time?
So again, unfortunately here in Florida, we have those rules which state that if you're doing some other procedures such as the breast augmentation, then the amount of fat that we can remove via liposuction is then lowered from those 4 liters that I just talked about to 1 liter, okay? So if you're a lower BMI patient where you don't have a ton of fat on you, then yeah, we can combine the breast aug with the Lipo 360 and the fat transfer BBL. But again, this is on a case-by-case basis. It's not for everybody. Certainly if your BMI is typically between 25 and 30 or above, you're not going to be able to combine those cases, and so you can then choose what you want to do. You can do your breast aug and then come back and do your Lipo 360 BBL, or the other way around.
What do you recommend for someone who wants to avoid a tummy tuck?
So first of all, the expectations need to be realistic, right? You can't just say I want to avoid a tummy tuck and then have like a lot of muscle separation or weakness or a ton of loose skin, right? So if you're borderline, say for example, your muscles are fine, right? So they're not separated and they're strong, okay? And you have mild to moderate skin laxity or loose skin, then we can try to avoid the tummy tuck by adding a skin tightening procedure. And so the skin tightening procedure is something that we would add at the time of the Lipo 360 or BBL. And the strongest ones that we have here right now, one of them is called Quantum, and the other one is called J-Plasma or Renuvion. Okay, so that's what I would recommend, but we have to make sure that you're a candidate first, and you have to understand the limitations of this skin tightening procedure. Because if you're truly a tummy tuck candidate, then the best thing to do is to get your tummy tuck. The only way to fix muscle separation, the only way to fix weak muscles, and the only way to fix, moderate plus to severe loose skin is with the tummy tuck.
If you lose weight after your BBL, will you lose the fat that you've placed for your BBL?
So overall, the answer is yes, especially if you lose weight within the first 3 months of surgery. So it's very, very important that you feed the fat and that you maintain your baseline or pre-op weight for the first 3 months after surgery to make sure that you retain as much fat as possible. But say you did that, okay, and then in the future, sometime after those 3 months, you decide to lose weight. Well, what's going to happen there is that you're going to lose weight proportionately everywhere, right? So yeah, you will lose some volume to the hips and buttock, but the overall shape will remain.
So the comment earlier about one breast being harder than the other, she responded and said it's after 1 year post-op.
1 year post-op? Okay, so in that case, the one thing that you really have to be thinking about is what's called capsular contractures, okay? I'm assuming by post-op you had some sort of implant, and so when you have an implant, one of the things that we worry about is that sometimes that wall that forms around the implant can become hardened or thickened, and that's what we call capsular contracture. And so that you can initially try to treat it via massage or sometimes some treatments like radio frequency. Okay, but if that, or even a pill, there's a pill that you can take that's called Singular. It's an off-label use, but it does help with capsular contracture, and you can try that as well. Now, if you've tried all of those things and none of that has worked, or the tightness and hardness has gotten worse, then a lot of times you do have to go back to the operating room to have that capsule either released or removed.
Thank you. We have a comment. You did my neighbor's BBL and tummy tuck. I'm interested in setting up a video consultation.
Yeah, all right, awesome. Well, thanks for that, and we would love to hear from you. So there's a couple ways that you can do that, but the easiest way is probably to go to our website, so www.pureplasticsurgery.com. You're going to find there an area where it says virtual consultation. Go ahead and fill in the questionnaire. Go ahead and send us your photos and all your information, and then I'll have one of my coordinators get back to you.
All right, 2 more questions. We'll do one from Instagram, one from TikTok.
All right, here we go. Boom, boom, boom.
All right.
1-on-1.
So from IG, how good are tummy tucks for someone who has an apron belly due to a C-section?
Yeah, that's like the perfect, that's basically what you need, right? That is what you need. So what do they mean by that? So a lot of times when you have a C-section, that scar like really becomes kind of indented in, and so then if you have a little bit of loose skin over top of that, it wants to kind of fold over that C-section scar. So that's kind of the apron belly, if you will. And really the treatment for that is the tummy tuck, because that scar basically gets released and all the excess skin gets removed, and so you're going to go from that apron belly to a nice tight flat abdomen. And if you're going to get a tummy tuck, you might as well get a smart tuck. That's right, so that's what I recommend for you.
Okay, TikTok question. Another one about tummy tuck. Is a tummy tuck the solution for diastasis recti?
So it's definitely, I think, the best solution for diastasis recti. There is such a thing as specifically only fixing the diastasis recti, and sometimes a general surgeon will do this for you. Okay, the problem is that it doesn't really then treat anything else, right? And typically, if you do have diastasis recti, it's usually after either a weight loss journey or one or multiple pregnancies, and so there's other stuff associated with it, right? There's a lot of like loose skin laxity, stretch marks, and things like that. So, in my opinion, the best way to deal with a diastasis is to do a tummy tuck. And so that way you can deal with everything at the same time. You can remove all the loose skin. You can do your muscle repair or plication. You can then, of course, do a little bit of contouring as well, because sometimes with pregnancy or even weight loss, the underlying contour is not there anymore. So the liposuction will help with that. And so you'll get like the best look, the tightest tummy with that tummy tuck. So I do recommend that as one of the best ways to deal with diastasis.
Thank you.
Okay. All right, awesome. Well, everybody, that was great. That was our first hump day for 2026. And I just want to remind you guys, we do this pretty much almost every Wednesday, somewhere around 4:30 p.m. I'm happy to answer all your questions, go over all of the plastic surgery topics. If there are things you want me to specifically to talk about in more detail, please let us know. Just write to us, let us know through comments or DMs, and I'll be happy to address that as well. Okay? All right. I look forward to seeing you all next week on Hump Day with Dr. Alex Earl. Ciao.